Okay, we'll finish up the musculoskeletal system, covering a few more things that are common to everybody, and then focusing on musculoskeletal problems that are more common in children. We talked about contractures. Contractures happen for a couple of reasons. Damage to muscles is very common. Loss of nerve signals to muscles. If you see somebody that is a paraplegic or quadriplegic, their hands have a tendency to curl up. As muscles atrophy, they have a tendency to pull in on themselves. So a true contracture is where the muscle is pulled without being stimulated by a muscle. That's not the same as muscle tension, which we get if we sit at the computer too long and you get up and you can barely move your neck, your shoulders are tight, or you're uptight because you're about to take a pathophysiology test and you get tight. You're actually stimulating the muscle in that case, and what you can't do is get the nerves to stop stimulating the muscles because of the stress-related situation, and so the muscles are in a kind of a constant state of at least semi-contraction. Atrophy of muscles occurs at about the same rate as hypertrophy. We talked about that in A&P as well. And so, you know, if you lift weights, your muscles get bigger, and if you stop them, they get smaller, and the rates are very similar, unless you have a more dramatic change that causes the muscle not to be used enough. Becoming a complete couch potato will cause muscle atrophy at a modest rate. You know, if you're pretty active and you just decide you want to lie around for a couple of weeks, you're not going to lose everything. You know, it'll be okay as long as you don't do it forever. But even worse is if it's stabilized like inside a cast where it can't move. Anybody that's had a broken leg and finally the cast comes off and they have this bird leg. Or if you don't get stimulation at all because you have nerve damage. It can be a disease, it can be something like muscular dystrophy that doesn't allow the signals to go to the muscles, or paralysis from an accident. And in that case, the cells which are normally getting stimulated every once in a while, even just by accident, and it keeps them active and healthy, if they're totally unstimulated, they first atrophy and then they die. And once they're gone, you can't get them back. You can hypertrophy the remaining muscles that are still alive if you can rejuvenate that nerve going there. And so when people get paralysis, it's very common for them to go in and have electrical stimulation done to those muscles to try to keep them viable just in case they can correct the paralysis later and they'll still have muscle cells to work with. Fibromyalgia is a more recognized and common problem. We don't know why it happens. It's not specific. There's no. It's idiopathic. There's no particular reason why the muscles and the nerves and the myofascia are being inflamed, and the fatigue. It causes fatigue. It hurts a lot. It gives you a constant state of kind of anxiety, which pain does anyway. Most people who get this are women, 30 to 50 years. It just comes on for no reason. Sometimes it goes away for no reason. Other times you just treat it with systemic kind of anti-inflammatory and pain medicine, a lot of people have thought that it was all in your head, partly because they tend to think that about women anyway, that, oh goodness, well, if it's a man, he really pulled a muscle, but if it's a woman, she must be just imagining it. But it's real, and it's the way you determine it is you have to find, there are certain places where it tends to manifest. And if you find it in 11 pairs of tender points, then you actually diagnose it as fibromyalgia. If it's just in the upper shoulders, it's probably tension related. It's not exactly fibromyalgia. Myotonia disorders, tonia means tension, myo is muscle. So myotonia disorders means you have a muscle that is overly activated or underactivated. So you can have a hypertonia or a hypotonia, periodic paralysis where sometimes you can't get the muscle to move properly. Sometimes it is related to potassium levels, because potassium is part of the action potential for muscles, and hyper or hypokalemia can cause muscular dysfunction. Hyperthyroidism can cause a hypertonia. It causes tremor. It stimulates your metabolic rate in all tissues to the point where the muscles can't relax. So that can cause a hypertonia type situation. Polymyositis means many muscles are inflamed. It's an infection. You could say it's kind of like fibromyalgia, but it's not really. This is caused by parasites or bacteria causing an inflammation of the muscles. Trichinosis, it can be a staph infection that is spread. Trichinosis used to be fairly common in people that ate a lot of pork because pigs used to have, it's a parasite. However, pork doesn't have trichinosis in it anymore, and therefore, at least, not when it's properly raised and prepared, and therefore, people now will even eat, medium pork that's medium instead of well cooked. Dermatomyositis includes an inflammation of the skin as well. So here's dermatomyositis. So it's muscle inflammation. But look at the inflammation of his neck especially, somewhat his face. Antimicrobials, antibiotics, antivirals, antifungals, antiparasitics. And muscle disease or muscle damage can be caused by toxic chemicals. You can eat things that are poisonous and cause it. The most common cause of toxic myopathy is overconsumption of alcohol. 1 or 2 drinks a day, your liver can metabolize. It doesn't then affect your peripheral tissues much. There's even some evidence that 1 to 2 single drinks a day is slightly beneficial. Not 3. Not 2 doubles. Okay, so we're not saying that drinking is necessarily a good thing, but it actually raises your HDL cholesterol slightly, And maybe it just relaxes people so they're not as likely to have stress-related problems. I don't know, but anyway, that's not saying that you should go out and drink a lot. But if you drink so much that your liver can't process it, it damages the liver too, but it'll damage the muscle and you'll get muscle wasting and lysis. Rhabdomyolysis, the death of skeletal muscle. So somebody who's a chronic alcoholic will become kind of skinny and weak. I mean, they might have fat, but they lose muscle mass. Move back to the skeleton, talk about some different kinds of bone tumors. Well, bones are organs. They have a lot of different kind of tissues. Any of those could go out of control and overgrow and become cancerous. Osteogenic comes from bone cells. Chondrogenic comes from the cartilage on the bones. Collagenous, connective tissue around the bones. Myelogenic is from bone marrow. Angiogenic is blood vessels in the bones. So all of these are possibilities for bone tumor formation, cancerous or otherwise. Bone tumors take on a couple of different kind of flavors. You know, here we have, they call it the geographic pattern, which looks like a lake or the state of Georgia or something. Moth-eaten lesion has a bunch of holes, relatively big holes in it, like your favorite sweater that's being eaten by moths. Permeative bone lesion, it looks kind of like moth-eaten, but it's more diffuse and less defined, and it's not distinct like this. Small pock marks. And osteosarcoma is one of the more common bone tumors. That's bone connective tissue tumor, really. So the fibrous connective tissue and bone. Adolescents and young adults. And we'll see osteosarcoma when we do the kids thing too. Here's an osteosarcoma. It tends to be at the ends of long bones. Knees, elbows, shoulders. Bone cancers are pretty bad. They tend to metastasize pretty easily and become life-threatening. Chondrosarcoma, a little bit older people will tend to develop tumors of the cartilages that on the ends of the bones. Okay, so let's talk a little bit about children. We'll see some of these same problems that we saw before, but with children it's a little different. You know, it's usually they get them early rather than getting them late. You know, with adults, it's often, it's situational, it's environmental things that build up over time. With a kid, it's often something, a predisposition they were born with, a problem that they had, a genetic abnormality or something that caused them to have an abnormality early in life. Fibrosarcomas, they are the fibroblasts, which are the cells that make the fibrous tissue. They become cancerous, they go wild, they go out of control, and build these huge, big, bulging tumors. Very dangerous, metastasize to lungs and other tissues pretty readily. Myelogenic tumors then develop in the bone marrow. They often come from osteoclasts. If you remember, the osteoclasts are the ones that eat bone and release calcium into the bloodstream. They're good. They raise your blood calcium when you need it. They also help remodel bone. If you have a healing, break, they eat away this big bulge and, make it right. But if they become cancerous and go wild, they cause bone resorption, but cause the bones to become very brittle, very weak. Rhabdomyosarcoma means skeletal muscle cancerous tumor. And so a kid who has a this is skeletal muscle. Your eyelids are skeletal muscle. They're voluntary controlled muscle. And this is a malignancy of that skeletal muscle around the eye. A couple of birth defects. They are teratologic. Terato means birth defect. So a teratogen is something like thalidomide that was taken by a lot of women after World War II and caused a lot of birth defects. Kids to be born with their hands right here on their shoulders and stuff. So a teratogenic condition is a birth defect. It may be because of a genetic abnormality, may be because of bad maternal health, drinking or doing drugs or whatever during gestation. Could be because of that she took a pill that, it says don't take this if you're going to become pregnant because it can cause birth defects. So anyway, a relatively common birth defect is the club foot, the turning in and clubbing of the feet. Adducted and supinated, so it's turning like this and inward. Called equinovarus, means horse foot, horse position. Varus movement is this way, and equino, so it was short and turned in, a little bit hoof-like. Positional it can be caused by binding the feet, as they did for years in ancient Asia, because they thought a woman looked better if she had little tiny round feet. Idiopathic means you're born with it for no particular reason. Teratologic means it was caused by probably a teratogen, a drug of some kind. And they use casting, they cut the tendons and lengthen them and straighten the legs out. A developmental problem that happens in some kids is called developmental dysplasia, which means poor development of the hip. And here we can see a nice head of the femur here and a nice acetabulum. Here's just kind of a mismatch over here, and it's not going to actually move into that hip socket well. Idiopathic or teratologic. So if you take something that's wrong, idiopathic, you don't know why, it can be caused by something like cerebral palsy too. Girls are more likely to have it. Not enough synovial fluid will cause abnormal growth of the ends of the bone there. There's a test you can do for this developmental dysplasia of the hip. The Galeazzi sign. You put the kid on their back with their feet pulled up to their butt, and if one knee is higher than the other one, then this hip is collapsing out of position. This one's where it should be. The low one is the deformed hip that is allowing that leg to sink down. Full size head here, only about half the size. A little break here. You know, here it's still kind of deformed. At 19 years, though, it has at least moved into the socket reasonably well. It's not as thoroughly in the socket as this one. This 19-year-old may always have a little bit of problem moving around or may need a hip replacement at some point. Osteogenesis imperfecta means imperfect creation of bone. And this is a disease that's called brittle bone disease. And these are some pretty dramatic examples of the bone just being completely abnormally developed. It's not as thick as it should be. It's soft. It's bending. And it breaks easily. And so, you know, if it's this bad, you know that your baby's got something really seriously wrong with them. If it's just kind of a touch of it, though, it's sometimes confused with child abuse. You know, the parents notice they're pretty sure their child has a broken leg, so they bring the child in and they x-ray it, and they find out that same leg has been broken 4 times in the past, and they suspect that the child's being beaten. And so, you know, you got to be careful about, you know, make sure you report child abuse, but make sure it really is child abuse before you report it. Actually, it's a collagen defect, and it's a genetic disorder. Straightening the bones out, putting pins through them, adding vitamin D and calcium and other bone supplements to try to make them stronger in their new position is the best treatment. We remember osteomyelitis. Happens in adults too. Starts in the end, works its way into the marrow, then, you know, squirts pus out the side of the bone. It can start out as a bone tumor, a bone cyst in the end of the bone, and then spread, or it can start from the kid kneeling on something, a nail, a piece of glass or something, and get an infection in there that then moves further. Pain, swelling, fever. It is an infection. Should cause fever. Elevated white blood cells. C-reactive protein, which is a marker of inflammation. Antibiotics and trying to debride or get rid of the damaged tissue. Septic arthritis. It happens with kids a lot with their elbows and knees because they're falling down and jabbing rocks and stuff into their elbows and knees and introducing bacteria into the synovial joint. And so it can cause damage. It can start as a cyst here and leak this way. It can come in from the outside this way. It can result in osteomyelitis. But it's bad. If infections in here, they'll start eating away at the articular cartilage, and then the kid's going to likely have arthritis for the rest of their life. Cartilage doesn't regenerate well. Septic arthritis, the pseudoparalysis, that means that the kid can't move their leg well, inability to bear weight. Staph infection is the most common. Remember, staph is everywhere. It's on our skin, it's on the ground, it's anything that you introduce into your body through the skin, it's likely to have staph on it. Kids can get rheumatoid arthritis. Fortunately, it's not very common. And the signs and symptoms are the same as they are for the adult. The swelling, the inflammation, the fibrous exudate inside the joint. It tends to start differently, though, because the adult, it starts in the hands and migrates to the big joints. In kids, it starts in the big joints and then migrates from there. So the big joints are affected first. It may only be a single joint. Still's disease means everywhere. All your joints have it. You're attacking all of them instead of just attacking one or a few. Large joints are affected first, and they don't tend to produce the rheumatoid factor, which is a good test for rheumatoid arthritis in adults. So a little harder to diagnose. Ankylosing or stiffening of the cervical spine, the neck and upper back. Osteochondrosis, this is bone cartilage condition. And these are a couple of conditions that often are related to a lack of blood supply to the end of the bone. So if something causes a cutoff in blood supply, avascular disease of the bone, you can have that in the scaphoid bone in your wrist. It's an easy bone to break. It's shaped kind of like a milk bone, and if you break it in the middle, the blood supply from one side isn't getting to the other side, and that part can die. You can have bone necrosis from avascular necrosis, from a lack of blood flow. So trauma, clotting, if you build blood clots up in there, sickle cell anemia that doesn't allow the capillaries to transport the red blood cells like they should. And leg calf perth disease is specific to the femoral head. It is a disease that is not well understood. It blocks blood flow to the head of the femur for a period of time and then resolves. The trouble is, if the head of the femur was damaged enough, it always is going to be somewhat damaged afterward. Lack of blood flow getting out here, causing some distortion and some necrosis down inside there. Not all that easy to see. Leg calf perth, it starts off, you're starting to get some inflammation at the epiphyseal plate, maybe a cyst or multiple cysts that block off blood flow getting out here, damages the head of the femur, so it starts forming procallus and then callus type tissue. When it resolves, it'll remodel the best it can. It depends on how bad it was damaged in the first place, as whether it can come back to a relatively normal head of the femur or not. Scoliosis is almost always idiopathic. Remember, this is lordosis. This is kyphosis. Scoliosis is a S-shaped curvature, sideways curvature of the back. It can be tetralogic if mom took something that she wasn't supposed to take. Sideways curvature of the spine. Sometimes it's so bad it's really hard for people to move around properly. This is looking from the back, so the spine is really curved dramatically. We're familiar with the term muscular dystrophy, like it's a single disease, but in fact, muscular dystrophy just means muscle poor development. And in fact, multiple muscular dystrophies can be caused by a variety of things. They can be caused by cerebral palsy. You can have a form of muscular dystrophy that doesn't allow the muscles to develop properly. You can have damage to a nerve that causes them not to develop properly. But Duchenne muscular dystrophy is the one that we call muscular dystrophy. And it is a inherited DNA abnormality that doesn't allow this protein to develop that causes the cytoskeleton inside the muscle cell to develop properly, and so the muscle cell can't develop well, it can't perform, they tend to atrophy and die off, and it gets worse and worse as time goes on. It's a progressive disease. A good friend of mine in the doctoral program where I was had muscular dystrophy. He was about maybe 25 or something like that, and he already was having a hard time getting around. I haven't talked to him in some time. I don't know how he's doing. Muscular dystrophy, loss of muscle, complete muscle wasting. This kid already is in a wheelchair. A lot of times they don't find out the kid has it until they're, at least 2, because before that they wouldn't be doing much anyway. But by the time they are missing a lot of markers of where they should be physically, by age 2 or 3, it becomes obvious enough to be diagnosed. Kids will be born with bone tumors or get bone tumors. Remember, children's tissues are growing very fast. When they're a fetus, all of their cells are almost like stem cells because they're differentiating into different kinds of cells. They're growing fast. And so they can lose control. Osteochondroma, this is of the cartilage on the outside here, and an extosis is a tumor that grows outward. Instead of growing into the bone, it's growing outward. Osteosarcomas are relatively common in kids. Again, this is a genetic thing. They haven't done anything wrong to get this. They're born with a predisposition. It's like having the BRCA gene or something that causes them to grow these remarkable tumors. Swelling, difficulty breathing, surgery and chemotherapy are your only options. Take away as much as possible and try to keep it from metastasizing. And the Ewing sarcoma is a kind of a version of these osteosarcomas that is a particular bone tumor caused by another genetic abnormality. I'm not asking you to memorize which chromosome they are. It's not in red. It doesn't mean you shouldn't know some of these things, but you should know what a Ewing sarcoma is. It's a fairly common childhood cancerous tumor, and it's extremely dangerous because it metastasizes very quickly and goes everywhere through the body. Ewing sarcoma. And non-accidental trauma means child abuse. You know, if they fall off their chair, then that's accidental. If dad gets tired of the crying baby and knocks it around, then that's non-accidental trauma. A particular one that can be identified, I mean, of course, any kid can get a broken bone if they're whacked with a stick or something. But there's a particular fracture that is common in child abuse that is kind of a giveaway to something that you might need to report. And this is a corner fracture, and what it is the head of the epiphysis of the bone is broken away from the diaphysis at the epiphyseal plate. Remember, that's not bone right away. It's cartilage. It's growing fast. It's fairly weak in babies, especially in young children. And if you grab them by the foot and pull and twist, you get this fracture at that point. Here we're having, right here, you can see this crack along here where the end of the bone has been cracked loose from the rest of the bone. And that's it for the musculoskeletal system.